Welcome to the Southwest Texas Regional EMS Time Out training video. The EMS Time Out report is a new process for hospital emergency departments and EMS providers to improve patient reports and the transfer of patient care. The purpose of this video is to educate EMS providers and hospital emergency department staff of the new EMS Time Out process in the STRAC region. This process consists of a clear and concise 30-second patient report delivered by EMS and documented by the receiving nurse on a standardized regional form prior to patient movement from the EMS stretcher. During the patient report, the paramedic is going to cover the missed mnemonic. The M is going to be for the patient's age and sex, mechanism of injury, or chief medical complaint.
Okay, let's take a time out, y'all.
All right, we have a 25-year-old female complaining of sudden onset of left-sided weakness and slurred speech.
The paramedic is then going to cover the I portion of the missed mnemonic, which is for injuries. That is the time of injury, list from head to toe, and the inspection, time of onset, brief medical exam and findings.
Onset of about 30 minutes prior to calling, so we're looking at about 50 minutes now.
The next step of the EMS timeout patient report is going to be the S, which stands for vital signs. This is where the paramedic is going to provide the nurse with the first set of vitals and any significant changes while in transport.
Vitals are blood pressure of 211 over 138, pulse is 117. Showed a sinus tach on the 12-lead EKG. Blood glucose of 94. She's 98% on room air.
The last part of the missed mnemonic is T for treatment. This is where the paramedic is going to cover all of the interventions and treatments provided on scene and during transport.
And we have an 18-gauge IV in the left AC.
The Southwest Texas Regional EMS timeout is intended to take no more than 30 seconds. While in the patient room, the receiving nurse will call EMS timeout, and all side conversations will be suspended in the room. EMS will deliver the patient report using the missed mnemonic, and the receiving nurse will document the information on the new standardized form used by all hospital emergency departments in the STRAC region. The nurse will provide EMS with the patient sticker upon completion of the report, and the patient will then be safely moved to the hospital bed. Let's take a look at an EMS timeout for a trauma patient from start to finish.
Right this way, guys.
EMS time out.
I have a 29-year-old female involved in an MBC. She has some head injuries. She has deformity to her left wrist. Her vital signs are 138 over 78. Heart rate is 100. Respirations are 22. 98% on room air, and her D-stick is 109. C collar fully immobilized. I have a 14-gauge right AC, and she has received 100 micrograms of fentanyl.
Thanks, guys. Big deep breath.
Good way for everyone, docs, nurses, paramedics, techs to all get on the same page.
Everybody gets the same report one time.
What's been done, what's going on, where certain things are on the patient.
Short, concise, and then you can start asking questions afterwards.
A lot of times the physicians and the nurses upstairs don't know what great work that the pre-hospital staff did for those patients. Induced hypothermia, what time was it really started? That's lost. This new form and this new process will help that not get lost in translation.
Everybody gets the same pieces of information right off the bat.
The docs upstairs, the nurses upstairs will know what our pre-hospital providers did.
Jessica, remind me to do EMS feedback on this guy. We can access it and find out what actually happened if we were right about that head injury.
I think you can actually access it off your phone.
Do you remember the address for that feedback?
I think it's on STRAC.org, and there's a tab called What's New.
Hold on. Oh, yeah, there it is. Oh, that's easy. You just have to put in some patient identifiers, and I guess I'll get back to you. Cool.
For additional information, please log on to strac.org or contact us at info@strac.org.